I have a question about the international perspective on this, because sometimes we're in a bubble here in the United States. Is it true that ECT was banned in Italy?
I've heard rumor that it was. I personally, I think at one time it was banned, but I think now it's used on a very limited basis.
Okay.
There are countries that still use it without the anesthesia. For example, there are places in India that don't use the anesthesia. There are places where the anesthesia is difficult to come by, and so they choose, they don't use the anesthesia. So there's patients that are getting it without anesthesia. We had people responding from more than 40 countries, and some people would say, well, what happens in a different country really doesn't matter because we do it our way in America. But the reality is they use American machines in the other countries, and the reality is there's no dosing consensus standards worldwide. They do not know how to give ECT with the maximum clinical efficacy and the minimal cognitive impact. Literally, that was said by Declan McLaughlin, who's actually a MECTA device rep, said that. It's published.
Let me ask you about the financial incentives. CMS
gosh,
a 72% increase in ECT reimbursement for 2025.
Yeah.
Geez, how does this kind of impact the likelihood of reform here? You've described ECT as the golden goose for psychiatric institutions because of the economics. Like psychiatrists can do a patient every 15 to 20 minutes with this assembly line approach. With over 500 possible dose configurations, no consensus on standards. Like, it's unbelievable. Your thoughts on these financial incentives?
I just think it's very risky if you look at fiscal year 25 for the Center for Medicaid, Medi-Cal, or not Medi-Cal, but Medicare, Medicaid, for fiscal year 25, there was like an overall reduction of 0.3% reimbursements across the board, except for ECT. ECT had a 72% increase. And if that doesn't increase the risk of overuse, I don't know what would. I learned of an 8-year-old who doesn't even have a psychiatric diagnosis, who is being given shock treatment at Vanderbilt. And the doctors, I think, because the FDA did not act on their final ruling, I think that's kind of emboldened some doctors to use it more often. I mean, for example, they were even saying, the article that I wrote with the World Health Organization and the United Nations Special Office of the High Commissioner of Human Rights, we were responding because some of the psychiatrists in America were getting upset about the joint report saying that giving ECT without informed consent is essentially torture, and that using it on children should be outlawed. That policy should be made to outlaw its use on children. So these psychiatrists are taking exception to that. But they are not acknowledging that they have no dosing consensus standards. They have no standard practices governing this treatment. And so they are essentially, all of them, unless they have an investigational device exemption on record with the FDA, every single clinical setting, community setting, is essentially performing this as an unmonitored human experiment on people who are not providing informed consent. I mean, that was outlawed after the Nuremberg trials. You cannot perform unmonitored human experimentation on humans without telling them.
Yeah.